physiotherapist. Today I'd like to talk about a very common condition. You see this all the time in the clinic. It's called patellofemoral pain syndrome. Now essentially what patellofemoral pain syndrome is, it's an issue with regards to the positioning of an individual patient's kneecap. So essentially what happens is there's a specific area in which or a space, so to speak, in which your kneecap or your patella runs between your femur and your tibia. Now, what can sometimes happen is due to various reasons. So for instance, if there's specific muscle imbalances, or for example, sometimes how an individual stands in terms of arch support can influence this, or in some cases just a hip to waist or a hip to knee, so to speak, ratio can influence the specific positioning of this kneecap. And what it's referred to is actually a tracking issue. And so typically what we'll see in terms of patellofemoral pain syndrome is a patient will come in, there isn't a specific incident that's occurred. So there hasn't been a trauma, there hasn't been a fall, there hasn't been an incident in which there was a plan to twist, something traumatic that's occurred. Essentially with this particular condition, it typically just comes out of the blue. It's an insidious onset of pain. The patient will complain about pain with prolonged sitting, for example, pain with going up or downstairs, typically a little bit more in terms of going downstairs. Sometimes there'll be pain with transitional movements. So for example, going from sitting to standing. Deep squats can sometimes influence the pain. And so essentially what's happening is that due to, again, the positioning of the kneecap, there's a rubbing on the undersurface of the kneecap, and this rubbing is what's causing the pain. So typically what we'll find is that the kneecap will actually move. It'll be moving laterally, so basically on the outer portion of the leg, and a lot of times this can be due to tightness in through the IT band. So the IT band essentially is connective tissue that runs from your hip down and connects onto the kneecap. So when it gets really, really tight, it will tend to pull, again, the kneecap out to the side. Another thing that we'll find is due to this tightness in the IT band typically is a result of a really, really weak glute med muscle in particular. So the glute med muscle is just along the side of the hip here, and what ends up happening is when that muscle is significantly weak, there's other muscles in the front of the hip that actually have to compensate for that weakness in through the glute muscle. And these muscles in through the front of the hip, they actually attach onto your IT band. So as they get tighter, typically the IT band will then tighten up, will pull the kneecap again on the outer portion, and then when you're doing these different activities such as prolonged sitting, squatting, sit to stand, stairs, going up and down hills, etc., that rubbing action then will cause significant pain for the individual. So what can we do about this? So there's a number of different sort of interventions from a physiotherapy standpoint that can be helpful with regards to this. One is taping. So essentially what you can do is you can use some form of athletic tape like Leuco tape, for example, and actually reposition the kneecap so that it's in a better alignment or better tracking, as I talked about before. Along with that, there's very specific exercises to do to essentially work on these muscle imbalances that I talked about. So I'm a big fan of using the foam roller in terms of doing some self-massage in through the IT band, stretching, specific soft tissue release for psoas and quads, so essentially muscles in the front of the hip, and then really focusing in on strengthening that glute med muscle, and then also to some degree the inner quad muscle, which is essentially the inner portion of your quad. Now what they're finding from a research standpoint is that it's very difficult to sort of isolate that, it's called your VMO muscle, the inner quad muscle. So from that standpoint, I'm more of a fan of, again, focusing in on that glute med strengthening. Other things that might be helpful is also working on some of the intrinsic muscles of your foot, in terms of, we talked about the arch or the foot being can be an influence, so to speak. Sometimes footwear or potentially some orthotics might have some benefits. And then also, along with the taping that we talked about before, what I find is if the taping is really effective, sometimes I'll recommend for patients, just again on a short-term basis, is actually getting a specific brace for the condition. So there are braces that can be, again, helpful in terms of helping with the positioning of the kneecap. And then what I tend to recommend is, while we're rehabbing in terms of getting on a specific exercise program to address these different muscle imbalances, to actually use the brace or use the taping in order to help with some of the pain from a functional perspective. So again, as we're doing this, the rehab process, if we can help with pain, why not? So that's where, again, the taping, the brace can be helpful. And then again, as the strength in the glutes improves, as the IT band starts to let go and release, then it's a matter of essentially weaning the patient off of the brace or the tape. So I hope this helps in terms of just giving some information with regards to this condition. Please feel free to leave any questions or comments below, and thanks for watching. Take care.